Do you have this same eye condition I have? If you look closely, you can see my eye is really red and it's got like a pimple bump on it. This is a condition I've been challenged with in the last few weeks, and it's been something that I've been battling for quite a while. There's a condition that some people have to deal with called Blepharitis. And basically what normally happens to me is I have flaking on my eyelashes, and normally during spring and fall it tends to act up. And they've described it to me as something like dandruff of the eyelashes, and what happens is these little dandruff flakes get in your eyelids and start causing redness. But more than that, what has been happening lately, and they say they don't really know why it happens, but there's these little things on your eye. I've got a little brochure that I got from my eye doctor. So I saw my eye doctor today, and I'm making this video as a public service announcement. This is in no way medical advice. I'm just telling you my experience of what I just went through. And so this guy is supposed to be a specialist in dealing with this condition. And the way he explained it to me, it's like your eyes have these little mites that kind of live on your eyelashes. And he says everybody has them, but it tends to be a problem for some people, and they say it's usually older people over 40, maybe in their 60s and older even. And some people it doesn't bother whatsoever. I mean, most people can live with this and it's not a big deal, but others tend to have a reaction with it, and these little mites just cause scalp or irritation on the eyelashes, and it causes the oil glands to clog up. And so what's happening is the glands actually secrete an oil to help keep your eyes moist. And I'm trying to explain it to you based on what my eye doctor told me. So if anybody is listening to this and knows otherwise, or maybe is a doctor, please put it in the comments and, correct me with that. But this is a brochure from a drug that he recommended that I take. And you can just see that in this picture, these little mites that kind of live up in the eyelashes. And of course it's causing that irritation and redness. And he looked in both eyes, and it's a problem in both of my eyes. And traditionally, what they had recommended me do is, on a daily basis and multiple times a day, take these wipes, they're special wipes, or, they used to tell me to use baby shampoo with a cloth and just really scrub my eyelids, on the inside eyelids, and the best I can do as close to the eye as possible, and just scrub the eyelashes. And it's basically designed to remove these flakes to help calm down the inflammation. Well, my condition's to the point where he prescribed a low dose of amoxicillin. It's sort of like an antibiotic, but it's 50 milligrams. And he said it's so low that it's not even giving you the antibiotic effect, but it's supposed to help lower the inflammation. And while I'm taking this, they've got an ointment he recommended that it's like an oil-based ointment that I put along the eyelashes, and I was supposed to put that on at bed, because once you have this on your eyes, it's kind of hard to see sometimes, and it kind of gives you a cloudy vision. But alongside of that, he wants me to basically, they've always told me to do hot compresses. So if you look this up on the web, they recommend doing hot compresses, but I don't know about you, but I don't have anything that really lasts that long for the heat. So I would try to use hot water with a washcloth and just hold it on my eyes. But before long, it's, the heat is gone. And then, I just can't sit there with a wet washcloth. And especially if they want me to do this during the day, I'm working, I'm in my car. So he recommended buying these off of Amazon. I don't know if you can see these. This is called Brooder Moist Heat Eye Compress. Microwave activated. So you can stick these in the microwave. They're fast acting and effective relief for dry eye and other eye irritation. So even if you have dry eyes, this would be a good thing to have. So you heat them up in the microwave, and then you just hold them on your eyes for, you know, they say about 15 minutes. And you need to do this at least minimum morning and evening. But more than that, he really wants me. He said up till now there's really not a lot of effective things for people with this eye condition, and you know, these things that I just told you are things that we can be doing now. And he says they'll do somewhat of calming it down, but he says it may not heal it. And he kind of went on to tell me that this is sort of like, you know, he used the analogy with cancer patients. You know, when they get cancer and they go for their treatments and then the cancer goes into remission, he said this is sort of like the same thing. He said it's not a treatment to get rid of it forever. He said it could calm it down and put it into remission, and he believes that this is something that I have to do on a daily basis just to keep it at bay. So right now, because it's extremely inflamed, I'm going to have to, you know, do this until we can get this drug. And I'm not even 100% sure if I'm going to do it, but it's called Xdemvy or something like that. It's a solution that you put a drop in each of your eyes in the morning and in the evening. So every 12 hours basically is the prescription, and it's a treatment that you do for 6 weeks. But I just checked with my insurance company, and this is not covered. And I asked them, I said, is this a drug that's going to be hundreds of dollars? And he said, well, if your insurance covers it, it should probably only cost you about $50. Well, I have a feeling this is going to be one that's going to cost in the hundreds. And he said they do have an option of getting it at a pharmacy in Orlando, and we got to go through a process of doing this. So hopefully it'll cover it, but he believes this is the best treatment at the moment. But the problem is, you know, these treatments that these doctors recommend, there's reasons why they're recommending, because these companies are making big time money on these products because they're so expensive. And I don't even know yet what my cost is going to be. So, but when they have a nice brochure like this, and the first thing the doctor pulls out is this thing, I'm looking at some money. So these are some before and after pictures. They say what it should do. No guarantees, but it's supposed to calm it down. And if you have contact lenses, of course, you got to remove your contacts before you try this. I haven't worn contacts in years, mainly my glasses. But he said that because of this problem, that it's like a zit and it's not draining, and if these heat compresses don't work, I'm going to have to go into the office and he'll have to do a surgical procedure to drain it. Which, you know, I asked him the cost of that. It's probably another $185, you know, guesstimate. So I guess my thing on this for anybody watching, you know, if you start to get irritation, like itchiness in the eyes, it may not be just a solution for just the Visine or an eye lubricant, because it may be something more serious. And the only time I ever worry about it is during seasons when my eyes start to get red. But this has been the worst one that I've had. And, you know, my wife made the doctor's appointment for me to see him. And it was covered under my insurance because it's sort of like a medical condition, not just a normal eye appointment. But keep in mind, if this is something you're going through, you may want to talk to your eye doctor and do it sooner than later so that it doesn't get to this point. And who knows where it could go. But he says these conditions don't cause any vision loss or anything, but it's definitely not going to be a healthy thing for your eyes and your eye health. And of course, it's irritating. I mean, I'm in sales. I make YouTube videos, and you know, if you noticed, I've been wearing my glasses more because it kind of hides it, but not really, because if you look closer to the video, you can see how bad it is. And he really was pinching. I've got it in the other eye as well, but not as bad. But he was pinching to see if he can release any liquid, and it wasn't really draining at all. So hopefully this video helped you. I'm going to probably do a follow-up video on this and see where it goes. But you know, now I've got to pick up the prescription from Publix. I've got the ointment and the antibiotic that I've got to start treatment on. And then they're supposed to contact me when when I can get this. So this actually has to be sent from the pharmacy in Orlando, and they send it through the mail. So I may opt to do this. If it's only about $50, I'm probably going to go with this treatment. If it's going to be hundreds of dollars, I'm going to probably do everything else that I can do, unless nothing else works. So I'm going to try the other treatments. I'm going to start doing these hot compresses. I'm going to order this thing here. These two. I mean, it's only $20 on Amazon, so I can't lose doing that. And I need that anyway. So if you need nice, good hot compresses, this is a great item to have. And I'm going to put hopefully a link in the shop down below. If you need these, please click this link to help support my channel. And if you think this video can help somebody else, please share it with them. Save it for future reference, because you never know when this thing might happen to you. And if you don't already subscribe to my YouTube channel, please hit the subscribe button and ring the bell so you get notified when I upload another video. You know, if you don't already know it, my channel is moving away from just hair videos to tech for people over 40, and you know, doing YouTube for people over 40, and more specifically people over 60 and up. So hopefully these kind of videos are going to help. I'm going to be doing more product review videos, and I've kind of got backlog lately because we started a new week with my current job, which, if you don't already know, I'm a on the road sales consultant for the salon center, who basically I call on salons selling beauty supply products. So I'm still doing that, and I'll continue to do that until either it's not fun anymore, or they let me go because I just can't perform as well, or I just get totally sick and tired of it. Or if my YouTube channel really blows up and people are really liking my content, and it just is more beneficial for me to go that route, I'll do more of this and less of the other. But my regular job is my bread and butter, and I'm going to continue to do it until it's just not worth doing anymore. So thanks for watching. I know this is a little bit longer, but hopefully it's good information. Take care. Have a great weekend.